So Cynthia, you're here today only like what, 6 days after I did your Achilles tendon surgery.
Yeah.
Well, for me as a practitioner, to have a smiling patient at 6 days after the surgery,
Definitely.
it's unusual. Okay.
I'm glad.
So, and you had a situation, I think a very unique situation, because I did your open Achilles tendon surgery a couple of years ago,
Yeah,
right? Like what, 3 years ago?
And that was tough.
Right. And I remember, like I told you, I said, listen, it's a wonderful surgery, but it really takes about 6 months to get better, right?
And it did. It really did.
And like a year to really feel 100%, right?
And that was tough.
So when you came to me the second time around, I think the first thing you asked me is like, I hope we don't have to do that surgery on the opposite foot, right?
I was hoping we didn't
And
have to.
I guess the time was right because of that new Tenex procedure, and I said, listen, let's do it because basically we have nothing to lose.
Yeah.
If it doesn't work, we'll always have the time and the space for the open surgery, but you know, you'll have to realize the recovery is no fun. So we did the Tenex last week, and you were what, 6 days later.
Yeah.
So well, tell me about your experience.
That night, I got home and it was amazing because for the first time ever going to bed, I didn't have the pulling in my Achilles like I normally do going to sleep when the foot actually flexes out. So I didn't have that pulling, tearing sensation. So that was like the first great thing, especially since that's been our biggest fear, is
Right.
that tear is going to get worse.
Yes, because remember how it started going up also, like we even like were suspecting that it's going up the musculoskeletal junction, right?
And that was scary in its own right, because that's another surgery on top of
Yes,
those
yes.
were. And I was like, oh, God, really, I don't want another surgery
Right,
on top of that.
of course.
So not having that was just like a big relief. And then like 2 days out, I realized that I could stand and I didn't have the pain in the heel. I didn't have pain in the back. And I was just like, this is the coolest thing ever. I'm standing, was just getting dressed to go to work for my first day back, and I was just like, I'm back to normal. I mean, I couldn't do anything per se, but I was just the coolest feeling that for the first time in 2 years, I didn't have that pain anymore. It was just, versus the last time, it was 3 weeks before I could stand on the heel.
4 weeks.
Yeah.
It's pretty much like 3 to 4 weeks. So basically, I'm very happy you're that much better at 6 days, but I want you to still take it easy.
Oh yeah, I'll still take it easy and stuff, but it's just a big change of life.
Go to physical therapy, you know, we'll do the lasers, we're still gonna, as I told you, I'm by the textbook, so we're gonna still follow that protocol because we don't want to ever this to recur, right?
Oh yeah, trust me, because that's my biggest fear with the right one, is that that's going to happen here again.
So the good news is I've never seen it come back.
Yes.
Okay? Well, with the right foot, with the open surgery.
Yeah.
With the left one, I just think that it's too premature to make that conclusion, because Tenex Procedure really has been popular for about 1.5 years, which is not enough time in our terms, right?
Yeah.
So, I mean, I've had really good success, but you know how it is with surgery, nothing is 100%. It's probably 90 to 95% chance.
At least it's such a nice
Good.
change. I mean, I was so afraid like having to be out 6 weeks.
Right,
like,
of
you
course.
know, and everybody was like, when they came back, they're like, aren't you here a little too early? And I was like, guys, I'm sitting at the desk. I mean,
You're gonna be
it's not that bad.
You're gonna be my walking advertisement.
Oh, trust me, I've already talked. There's like people at work that were already asking me about it, and I was like, yeah, you gotta talk to Dr. Wellens. This is the number to call.
Oh, you're
Go
so
for it.
sweet.
And they were just like, are you serious? We have like 3 runners who do half marathons at work. One of them's in sales, and he's got issues. And I was just like, go to her, let her know. And he was like, are you serious? And I was like, dude, this is, I mean, I had surgery and came out yesterday. You know, I came out on that same day, and he was just like, all right.
Well, thank you so much for your testimony. I just love the new technology, you know, it's like amazing.
This is awesome.
Right. We needed it for a long time.